Good morning to you, Charlie.
Hi, Julia. Thanks for having me.
Well, thank you very much indeed for joining us. So, of course, your old boss, Michael Gove, gave evidence as well in the last week or so. He started with an apology to people about decisions made. He's standing by, as he's done in private with me as well, by the decisions to lock down, basically saying, look, you didn't do everything right. The fog of, the chaos of the pandemic, we might have got things wrong and we apologise for that. I'm still very alarmed that no one ever seems to be asked the question at the COVID inquiry or raised the issue of whether we should have locked down at all. The entire focus this week is going to be yet again on shouldn't we have locked down earlier, Prime Minister? Do you think those are the right questions to be asking?
Well, I think there's definitely a case to ask, after perhaps the first lockdown, which I think was broadly accepted by the majority of the population. Now, there's a question about whether that was too late or not. That's something that you rightly have said is something that's dominated the conversation. But I think in broad terms, the first lockdown was sort of accepted. But thereafter, did we need to have another lockdown in November? Did you need another one then again in December, 2 weeks later? And then the path to reopening the economy and reopening the country with all the different tiered systems, the colour coding systems, the different rules and regulations in different part of the country, depending on what tier you were in, going from January 21 through to I think the summer of that year, the unlocking process, all of those decisions do need to be heavily scrutinised. And I think, at a time when we've heard and read the text messages between advisors and politicians and senior civil servants, there was clearly a breakdown in trust, too much ego. But the buck stops ultimately with the Prime Minister and his influence over Downing Street and those
well, indeed.
decisions.
And it's amazing how many people will often defend him, saying, look at all these messages. It's clear he didn't want to lock down. He didn't want to do it. He was bamboozled into it. And I think, he was the Prime Minister. He was the one who could have said, no, I refuse to accept this. I want more evidence. But this is the key thing. You say, look, I accepted the first lockdown. I wasn't calling for it to happen sooner because I trusted the medical and scientific advisors who said very clearly we shouldn't lock down. And then I thought, oh, something must have changed. We now know there was no new evidence. There was a stupid, ridiculous, absurd computer model that we knew was wrong. Everyone knew it was wrong because the man who made the computer model, Neil Ferguson, had been wrong about everything he'd ever done. People accepted it because they assumed that the government was making decisions based on scientific data that showed that it needed to. We now know that they weren't. It was a panic. It was well, everyone else is demanding it. The media, the public, the teaching unions. They did a load of things they'd categorically ruled out before. They did a load of things which no pandemic plan had ever included. They followed China instead of their own pre-pandemic planning. Sweden didn't. No one at the COVID inquiry is examining why does Sweden have a lower excess deaths from all causes over the last 3 years than we have? And, by the way, every other country, including all Nordic countries, when they didn't lock down. If lockdown saved lives, and an earlier or a longer or a better lockdown would have saved more lives, how did the country that did not lock down have lower deaths than us? And no one's asking that question. And no one's answering it, including your old boss, Michael Gove, who, by the way, has got off scot-free for a lot of the terrible decisions he made during that process.
Well, I think there's a lot in there, and look, there's certainly a question about international comparison. So, how did other countries fare better? Why did they fare better? That might not be something for the UK COVID inquiry to tackle, because I think that's obviously going to be focusing on the decisions that Michael and Matt and the Prime Minister.
But it is valid. We're mid-table. We're mid-table. We have completely and utterly sort of average mid-table results, and for a first world quite fat country, we probably did quite well.
It is totally valid, and I think the question that the UK COVID inquiry will have to ask is: look, after then, there's an acceptance of the first lockdown. Why were the decisions not taken earlier to perhaps do more testing or or why did we not have the testing capacity in the first place? Why did we not have a very
Sorry, but Charlie, again, this is what scares me, is that commentators like you, people who work for government ministers, still go, countries that barely did any testing did better than us. There's no proof that mass testing saves lives.
Well, I'm not disputing the league table or how one's fared, but an international comparison or comparative study will have to be taken. But I don't think that's necessarily something that UK taxpayers will just want to fund.
But surely that's the main thing we should be doing. Look at our decisions. What did we do differently from other countries? Which countries did better than us? What did they do? Well, the country that did the best didn't lock down. That's all we need to know. So why are we discussing, oh, should we have locked down sooner? Was the first lockdown OK? The second lockdown not? Shouldn't we just be saying, should we have lockdown at all? What was the evidence base for that decision? The evidence base was literally zero, but they lied and told us it would save lives, and it didn't.
Well, the balance between the health professionals and the modelling and the scientists versus the politicians. So I think it's something that this COVID inquiry really will have to bring out, because I think what you're touching on there is that, yes, it was very scientifically driven, and I say that in inverted commas because, as you say, there are other countries that fared better than us that didn't take such interventions. So the balance between how much of an influence the medical profession had over the Prime Minister and the politicians, was there enough discussion? And in my view, there was never enough discussion about the numbers of COVID cases, absolutely important and imperative as that is. But you could see those figures on a day-to-day basis. We were obsessed with those numbers, those daily press conferences updating. What there was never a focus on, it seemed to me, or certainly not enough focus on in government, was the numbers of people that you couldn't see. The numbers of people
exactly,
in schools,
Charlie. You've nailed it. No one's even mentioning those people. Don't get a look in at the inquiry. Charlie, Rowley, so appreciate you joining us, former special advisor to Michael Gove. We're probably going to have to go talk about this a little bit after, but a very quick word from you, Tom Slater.
I think it's just we need to scrap this COVID inquiry. It's become a ridiculous circus, and it's just about it's the opposite of what's supposed to be. It's about dodging accountability rather than actually doing it.